Good morning, good afternoon, good evening, depending on where you are. It's always nice to have you join us. It's Monday, same time, same place, as I like to say when I end. So welcome to this webinar of a GHPF. You just saw a short video of our last 18 years in service to the people, improving the quality of life. We just changed our logo. So we're now starting our next set of many years with a new logo. We're very excited about this new phase. So just to be able to get started here today, again, this time, about a couple of weeks ago, I did the presentation on safety in medical laboratories. And I did mention that I didn't cover all the clauses. The standard ISO 15189 has 19 different clauses, 16 if you remove away, you take away the scope, normative reference, and the terms and definitions, then you're left with 16. So we went through the first 10, and now I'm going to go through the remainder of them, just so that we can finish that standard. Again, my name is Kilian Songwe, and I am the President and Chief Scientific Officer at Global Healthcare Public Foundation, and it's a pleasure to have you with us today. So as I said earlier on, I'll be looking at ISO 15190. That's the standard for safety. And this is based on ISO 5189, which is the standard for medical laboratories quality and competence. That's a very important standard. Actually, there are a number of standards that actually relate to this that we are able, or we should be able to use either in performing the things, the tests, sample reception, sample storage, sample identification that we do in the laboratories. There is a very high degree of safety that is required, A, to keep the integrity of the sample, and B, to be able to ensure the health of the healthcare workers is always good, strong, and ready to continue to do the work that we do. So I'm actually bringing this, making this presentation on two standards, the ISO 15190, the 2020 version. In actual fact, this standard was just released this year. I know this year has gone so fast. So much has happened this year. A lot of us don't seem to remember when January was. This standard was released in February of 2020. And between then and now, we've had to deal with COVID all around the world. Actually, even a reason for which there is a great accent on why we should be looking at ISO 15190 and looking at 15190 in relationship to what goes on in the laboratory space with ISO 15189. So again, this is what you would see when you go to the ISO website looking for the ISO 15189, which we're going to look at. I always like to start this by just going back to some of the things that ISO has been doing in the last 74 years. That's a very long time. And basically, the whole intent was to be able to bring some level of standardization, some level of effectiveness, some level of reliability amongst activities that we do using different sets of standards. And what you see on my screen now, the two standards that I am working with, the ISO 5189 and the ISO 15190. I'm going to talk in the next few seconds as to the codes you see next to it, the 3060 or the 6060. Those are very important codes when you want to be able to appreciate where the standard is and how it is being used. So international harmonized stage codes, the stage codes go from the stage, and if you go from your left to your right, it has a sub stage and it has a decision stage. Basically what you have for each standard is the standard could either be in a registration phase, and if it's in its registration phase and it's in a preliminary phase or a preparatory phase, it would have a stage code which will either be 10 or 20. And then you will have a sub-stage code which will either be 00 or 2020, determining what the actions are at that particular point. So basically, when you see a standard document and you're looking at it and it tells you, it gives you a code, say for example, it gives you a code at 6060, basically, it is actually saying it's in publication stage and it's been completed. All the main actions have already been taken. That's a measure stage. Or if it says 9060, it means it's in review stage. It has gone out for public review. Everything has been looked at. Everybody is happy. And now it is actually in the review phase post-publication. This will usually happen when you're moving from one edition or one version to another. So if you took ISO 15190, for example, which was now just revised in 2020, that would be a change which would only have happened after the review stage, which would have been a 9000 or a 9020 had actually happened. So it's very important to understand how some of these codes come about and their utility in helping the standards come into bearing. So 2-3 weeks ago, when we looked at safety and the standard ISO 15189, I had actually at the time, again, eliminating the first 3 clauses, the scope, the normative reference, and the terms and definition. These were the first sets of clauses we looked at, designing for safety, safety management program, hazard identification and risk assessment, biosafety and biosecurity hazards, chemical hazards, physical hazards, and emergency preparedness and response. These are the things we looked at the last time we discussed safety. So going forward, we have a number of clauses that we still have to look at. There is safety, laboratory ergonomics, equipment safety, safe personnel work practices, personnel practice, protective equipment. PPEs are something that we've come to hear so much of with the advent of COVID in the last 8-9 months. Transport of samples, waste disposal, housekeeping practices is a very important area I like to spend some time on. Incident, injury, accidents, and occupational illness are some other important things with regards to safety. So just as we get ready to delve in, again, at the beginning of the standard, I mentioned the 3 top clauses, the scope. The normative reference for ISO 15190 is the ISO 15189, which is the medical laboratories requirements for quality and competence. That's a very important standard. And then the terms and definitions basically come out of the same standard. Again, I just want to remind you of some very key terms that we've come to hear being used of late. Biological agents. These words have been used ever since the advent of Ebola or HIV and those kinds of things, but now we've heard them even more often than before. Any microorganism, including those which have been genetically modified, or biological safety cabinets. There was a big scream about the fact that all SARS-CoV-2 samples had to be received in a biological safety cabinet. Simply a ventilated enclosure intended to offer protections to the user. In this case, we're looking at the healthcare workers. And then there are these 3 terms here which are very important to note. There is decontamination and disinfection. Decontamination basically eliminates or reduces the microbial or toxic agents. And then disinfection is the process of reducing the number of microorganisms. But it's important to note the difference between decontamination and disinfection with regards to sterilization, because it's only in sterilization that we talk about you actually render free from microorganisms, which basically means there's a total elimination of the potential of the microorganisms. That's a very important difference between them all. This slide actually talks about how do we actually try to eliminate the possible risk and or hazards in the space in which we're working. This is a rather important slide talking when we think about occupational health and you think about where we've come from in terms of the changes that we have to do in the workplace to be able to get ready for the work that we're doing and to be able to manage the SARS-CoV-2 samples as they're coming. So from the very beginning, the first thing that was actually in the workplace was the element of having the right PPE. And this is PPE from the people who are going to do the collection of the sample, the people who are going to transport the sample, the people who receive the sample and actually test the sample. So in terms of reducing the risk associated with any potential infection, you see what you have on my extreme left, on your extreme left as well, is an arrow that tells you what you could do starting from the PPE all the way to elimination. And on my extreme right, it just gives us a sense of where these things are actually happening. So when you talk about administrative control, change the way people work, this has been very important because when SARS-CoV-2 or COVID-19, as it has come to be known, dropped, This actually got into our laboratories, and we had other tests that were already going on in those laboratories. And then we had to add COVID-19 testing to this. So of course, there needed to be a change in the work dynamics. There needed to be a change in the number of shifts that the staff worked. Engineering isolate people from the hazard. So basically, in a lot of the laboratories that are currently doing COVID-19 testing, they've kind of isolated a room specifically, a room or two specifically for receiving the sample, and then a whole area for testing the sample to be able to meet proper polymerase chain reaction testing, which will mean 3 different isolated rooms for doing all the mixes and reading of results. Then, of course, there is substitution, replace the hazard. In this case, we cannot just replace COVID. So in terms of replacing COVID or physically eliminating COVID, those two are absolutely not going to happen right away. There is great excitement of the vaccine that is on the way. I know it's Ghana, Senegal, Kenya, and South Africa have been working on their own rapid detection test kits to be able to do some local brood testing and reduce the cost of testing. That is going to be phenomenal, but also we need to start the study on our own vaccine, because the virus is known to be mutating very fast ever since it came out in December of 2019, and thus the name COVID-19. So the last slide from where we ended last time before we go on into the new slides, emergency preparedness and response. Laboratories basically, in today's world, they need to be ready to respond to a number of things. And in this case, the response is to the COVID-19. But they also need to be able to respond to something as simple as, and I hate to say this, but that's a real example, a school bus. A school bus has 60 plus students in it on a trip, and then there is an accident. The hospital needs to be ready. They need to be prepared for that kind of a disaster. The labs need to be ready to A, have the right codification for the samples when they come in, because they might not know the names of the students on the bus. B, be able to be ready to start testing as fast as possible. C, have theaters ready to be to take people who need surgery, and scans ready to be able to see who is having any internal bleeding. So emergency preparedness is very important in terms of looking at response. But again, emergency preparedness with direct relations to the lab. First aid equipment and procedures need to be in place. Not just being in place, but people need to understand how to use them. Eye wash facilities. Eye wash facilities are important. We see them in a lot of facilities, but you have to remember to flush them every once in a while, because you don't want to show up at the eye wash facility and it has not been flushed in the last 2 weeks. And then instead of cleaning out your eyes, the first thing that you do is you first of all contaminate the eyes before you try to clean them out. So having an eye wash facility is good. Ensuring that you flush it every so often. My preference would be every 72 hours, just make sure that it flushes. And then good water supply. Water supply is a very important thing, depending on whether you're using rainwater, borehole, or pipe-borne water. It's very important to have continuous flow of water supply. Emergency drench and showers. This as well, you need to have a good volume of water to be able to drop on any individual in the lab if they had a spill of an acid or some very corrosive ammonia or something like that dropped on them. They should be able to show up under a shower and be able to have huge gallons of water just drop over them and be able to rinse them. Then, of course, there is the spill response. The spill response could be from chemical waste, or it could also be to any of the pathogens that actually spills in the lab. So, starting on today, we're talking about fire safety. Fire prevention and control it starts actually from the actual construction of the building. And in preparing for this, I actually spent some time just to revise a few notes on the construction of our laboratory space, theater space, radiology space. What exactly are we looking for when we're doing these kinds of construction? But this is very important because we need to be able to ensure that we have the right thickness of the walls to be able to ensure that the fire does not spread if there is ever a fire. And there are many reasons why there could be a fire. It could be from just an electrical spark, and then you have the wrong set of chemicals around, or you could have oxygen tanks next to a spark, and then all you have is a really big explosion in the lab. Then you have flammable material and storage. A lot of the flammable material comes in cylinders, and very often, a lot of the time, people don't remember that those cylinders are supposed to be anchored to a wall so that they don't have any room for falling down or people running into them. Then alarm systems. Alarm systems could be any sort of things. It could be from a whistle. I've seen labs where they have a whistle in the lab, and should you identify a fire, you just pick the whistle and you blow it. The only difference here is that people might think there is a soccer match about to start. But if they've done the fire drills, they will know there is no soccer match about to start. They will know that that's an alarm that is being sounded. Fire risk reduction strategies. Again, the whole risk assessment has to be done. It has to be looked into to ensure that the facility is safe, that they have the right exits for visitors, for the lab staff, or anybody who is in the lab space at that time. Then the fire prevention and training programs. It is very important that we have the right training when we're talking about fire prevention, because there are different things happening in different areas of the laboratory. It could be at the work area where we only have paper. We need to have the right fire extinguishers for that, for the administrative area. We need to have a different kind of fire extinguishers for our IT rooms where we have our server and a lot of the cables going through. We need to have a completely different set of extinguishers for when we are actually in the lab dealing with a number of different reagents. And then the training program, of course, ensuring that every time we have a new chemical that is not part of our testing system, that people are trained on how to respond to an adverse effect of this new chemical during a fire. Evacuation plan. I don't know how to overemphasize this, but you need to have an evacuation plan. Almost at every wall in the lab, every office, every enclosure should have an evacuation plan. And it basically starts with a very simple, important dot that says, you are here. And then it shows you have to be able to exit from wherever you are. It will be very important to make sure that you don't have to cross more than 2 doors when you're trying to exit, because the fewer doors you have to cross to be able to exit, it's actually very important. Plus also it holds the fire in place. Then the firefighting equipment, which I've just alluded to, thinking about the different areas where you could have the fire. But when we're talking about the fire equipment, there are portable fire extinguishers, which are easy to handle. A lot of them just hanging on the walls in different facilities. And then there is the fire blankets, which is, depending on the size of the fire, you would have to make a decision. And then, of course, there are the automatic water sprinklers, which will automatically start sprinkling. Sometimes you also have to be careful because there are times when the automatic sprinklers will come on and there is really no fire, and so people are not ready to evacuate, and then you have testing that is going on. Then while we're talking about fire and safety, there is emergency exits and evacuation. The point of egress is a very important thing. I've seen people who have the point of egress on the backside of the lab, and right when you go to this point of egress, which is usually the assembly point, what you end up with is a wall or a fence. The point of egress is very important to always be in a continuous motion towards egress. What does that mean? It means you cannot move people out of the fire and then have them enclosed in a section. Supposing the fire goes out of control and the people are standing behind the facility and they can't jump over the fence, there is a huge wall there. They're going to be suffocated by heat and smoke. So your point of egress has to be in a continuous motion to completely evacuate the space. Once the fire marshal decides that you cannot go back into the facility, you have to leave, then you continue moving out of the facility. You don't have to think about going around the fire to be able to exit. Or should the fire marshal decide that, yes, you can access the facility again, you should be able to move in very carefully and sure of the fact that should you still find anything going on, you can certainly exit. I know you can't see the slide, and I deliberately put this there so that you should not see it because I don't want you to get this information for almost free. But anyway, the point here is I want to go to talking about there is a minimum resistance that is required when we're putting up structures for facilities, especially healthcare facilities. And it talks about a minimum of 1 hour or 2 hours of a burn rate. So what does that mean? Basically, if you look at this slide, it says 1 hour, and it tells you that the thickness of the wall should be at least 3.2 inches thick. So if you're going to ensure that you put up a facility where the fire is going to be held for at least an hour before it can move into the next space, it means the walls would have to be at the minimum 3.2 inches thick. If you wanted to look at 1.5 to 1 hour to an hour and a half or 2 hours, what you see there is the thickness of the walls, which is going to be able to ascertain the fact that the fire does not move from one room to the next room. This is very important because when you're dealing in the medical space, the minimum requirement in the standard ISO 15190 actually requires for you to have a minimum of 1 hour minimum thickness or minimum resistance for the fire to move from one space to the next. So I just throw this in so that you think about it. We need to also know what the thicknesses are supposed to be when we're talking about X-ray rooms, radiology rooms, and those kinds of things, because there is also electromagnetic waves that are moving, and we want to be able to ensure that these waves are contained within where they're supposed to be. So that's it. So the whole idea here is from the very second that construction begins for a laboratory space, something as simple as ensuring the thickness of the wall, ensuring the height of the wall becomes very important to ensure the fact that we take care of the fire from the very beginning. In case of structural fire, what should happen? The term RACE has been used many times. I just bring this in again, just to remind people of RACE. Rescue, set an alarm, contain the fire, and then extinguish it if you have the right fire extinguisher. Whether it's a portable one, it's a sprinkler, you should be able to set it up. But RACE is a very important acronym to remember in the times of fire. Rescue anyone in the immediate danger of the fire. Again, remember, this is going to be the lab. You might have a client who came in and they are supposed to have a phlebotomy procedure. And while they're there, they're in their wheelchair. You don't want to run away and leave them there because they can't get off their wheelchair, they can't go. So you want to be able to remove them from that space. Sound an alarm while you're taking them off. The alarm might be on your way out. Or if you have a facility where you have to take a whistle and you have to blow, please just remember where the whistle is. Run for the whistle first before you run out, and then blow the whistle so that you can reduce the number of people who would be in the space. And then, of course, contain the fire if you can. Close doors, reduce the amount of oxygen airflow into the space, and then get an extinguisher and go to the base of the fire and start blowing from there. It's expected when you do the fire drill that everybody should, I spoke earlier on about the training program. The training program in the laboratories for safety is very important. And the fire drill is actually one of the important pieces to the training program, ensuring that everybody gets a chance to actually spray the extinguisher, not just look at how it is done by the fire marshal, but actually learn to carry the cylinder, learn how to point to the base of the fire and actually learn how to spray, but also learn how to read the gauge on the cylinder to be sure that you have the right pressure and volume in the cylinder to start fighting the fire. Then there is laboratory ergonomics. One of the things that has come to be known on the African continent, sub-Saharan Africa, which I'm most familiar with. A lot of our laboratories have actually sprung up as an afterthought. And as a result of the fact that they spring up as an afterthought, there are a lot of ergonomic requirements that are actually not met in trying to do this. So a lot of our activity space, you have somebody who is sitting in front of a microscope and they don't have any place to put their legs, yet they have to sit comfortably to be able to read the microscope. And unfortunately, there are cupboards below them which are actually closed. So there is no way for them to be able to sit comfortably to read the microscope. Yet they have another 40 slides in front of them that have to be read. That poses a very serious ergonomic problem for their back, for their method of seating, for their levels of concentration. So I just put here a list of a few things that we need to take into consideration when we're thinking about laboratory ergonomics. And again, I think it's important that I mention as I go through this, that I'm not going into a very deep, detailed conversation about the ISO 15190. This is basically is an overview, highlights of some important things that we need to be thinking about, we need to have in consideration. Frequent pipetting. With COVID-19, we have laboratories that traditionally would have been doing, say at best case, about 1,000 tests a day. And now suddenly they're doing 3,000 to 5,000 tests a day. Instantly, they have the same workforce. The level of pipetting has increased 300%. So you have frequent pipetting, that becomes an economic problem to the staff in that laboratory over time. Use of optical microscope for prolonged periods. If you're going to be sitting under the microscope for long periods, again, there are two things happening here. One, you're sitting under the microscope for a prolonged period. And then secondly, you're sitting in a position where your legs are not comfortable because right below the microscope is a cupboard as opposed to a pigeonhole for you to be able to put your legs comfortably. Computer workstations, there is the need for anti-glare on your screen. There is the need for you to be able to sit comfortably away from your screen. Otherwise, over time and over days, it's going to have a negative impact on you. Microtomes are very, very critical in terms of how they are managed, in terms of how you move things around. Then, of course, there is the biological safety cabinet, which we spoke about earlier on. Then the equipment itself has to be safe for use. The equipment itself has to be safe for use. And when we're talking about equipment and them being safe for use, the primary and most important thing to think about is the manufacturer's instruction. Many a times we receive equipment and they come with instructions, they come with a guide, they come with a manual in a language which is foreign to us. It is very important that when we do receive equipment, that we get the manufacturer's instruction in language that we can read, we can understand, and we can truly comprehend, because the manufacturer's instruction tells us everything from something as simple as how do you receive the equipment? What do you check on receive? How do you validate or do verifications of the equipment? How do you put it into service? So equipment safety, there is one joke I always like to talk about. In the States, when you buy equipment, you have to actually go through the catalog and go through the catalog carefully because something as simple as the power cord is actually called an accessory. It's not actually part of the equipment. And I remember working in a country a couple of years ago, and they ordered a very beautiful fridge to put in their blood bank. But they forgot to order the power cord. They forgot to order the trays, which were all accessories. And then the fridge shows up. They fly in a technician all the way from Johannesburg, South Africa. The gentleman comes, opens the curtain, gets the fridge out, and he turns to them and he says, "So where is the power cord?" And everybody starts looking. He says, "No, you're supposed to order the power cord." And they hadn't ordered the power cord. Guess what happened? The guy goes back to the hotel. He sits there for another 3 days, incurring a big bill, and they're waiting for FedEx to ship a power cord for them to be able to turn on this fridge. So looking at the manufacturer's instructions, looking at the manufacturer's manual is a very key part to equipment safety. We're so used to our centrifuges. You open them, you close them, you open them, you put in a couple of test tubes, you close them and you spin and you're happy. But there is something as simple as the rubber O-ring around the closure. It's very important to ensure that that O-ring is still there and it is not deteriorating, because in the event where you have a test tube that breaks or you have any aerosols and the O-ring isn't there, you're suddenly going to have a splash, which means that the equipment is soiled, but also the healthcare worker is instantly exposed. Water baths. Water baths are very common in microbiology labs, but also they're also a source of major contamination. So we need to ensure the fact that every time we have a water bath, that we have some kind of phenolic detergent that is inside the water bath to be able to kill any microbes that might stray into the water bath. Then there is the conversation of mixers, blenders, sonicators, grinders, and lithalizers. All of these things, these are small tabletop equipments that we could use, but each and every one of them has a very high potential to create some kind of splatter, splash, or aerosol. And so it's recommended that you use them under the biosafety cabinet to ensure that anything that comes out of it doesn't go to the healthcare worker, but stays contained. I spoke earlier on about pipettes and pipetters. Just the mere fact that if you don't do your pipetting correctly, if you just pipette straight down the middle of the test tube, you're going to create huge bubbles, you're going to create a splash, you're going to create an aerosol. And guess what? Your head will be right over that test tube, or your head will be right over the plate that you're using. If you're doing a PCR test, you would have the 96 bar plate in front of you. And if you don't do the pipetting right, instantly you would have a splash that creates, puts you at a health risk. Then just to mention a few more, there is of course the microscopes, talking about using a face shield with microscopes, automated analysis equipment for sample examination. This is key because a lot of the time, equipment safety is very important. And if you have any of the tubings blocked, basically what you have is you have a potential for a backflush. And if you have a potential for a backflush, basically what you're saying is you're actually increasing the potential for contamination of your reagents. And thinking in this case of if you're working in a hematology lab, a lot of the hematology labs for doing their full blood counts or the whole blood count, a lot of the time they have lysis, which is sitting in a big container, and a backflow into that could create a big problem for future tests going forward. Mass spectrophotometers, flow cytometry, these are all areas that expose you to a lot of aerosols, and we need to be able to think about how we work them. Safe personnel work practices. It has been said one too many times. I know conducting many audits with labs that are just beginning to get into a quality management practice. People would always ask me, where does it say that no food or drink in the lab? It is my hope that if you're listening today, now you know where it says no food or drink in the lab. That's actually in the safety standard ISO 15190. ISO 15190 recommends very strongly that there should be no food or drink or anything eatable in your lab. You don't want to be able to mix this in the space that you have. And you want to be able to stay clear. Then, of course, there are simple things like cosmetics, jewelry, having a nice net cap to hold your hair in one place. You don't want your hair going into your reagents or your testing solutions. Smoking in the lab, that's something which is a complete no-no in a proper lab. Personal property, you want to be able to have a locker room, in ISO 15189, and I think that's clause 5.2. One of the 4 important things in clause 5.2, where it's talking about location and environment of the lab, it actually talks about personnel space, and there should be a locker room for people to keep their personal effects. But unfortunately, a lot of the time we see people's phones that are doubling as their timer, and they're also doubling as their radio. They also happen to be in the lab a lot of the time because the lab also provides for them a power source to be able to repower their phones. Festive decorations, we need to be careful. Yeah, there are lots of, we're actually going into December, and so there is a tendency to want to decorate the lab. But if we can keep the decorations to the administrative area, that is going to be great so that we don't have anything. Some of the colors on some of these decorations could actually be reactive with our acids. So we want to keep our decorations to the administrative space. Hand hygiene, I don't think hand hygiene has ever been more emphasized than it has in this COVID period. That's a very important thing. Mouth pipetting, the ISO 15190 still talks about mouth pipetting. It is my hope that coming from good laboratory practices, this is something that is long gone and dead for a long time. And then how we manage our sharps, personal protective equipment, the clothing we put on before we get into the lab is very important. We have to be comfortable. We have to wear clothing that allows us to breathe. The clothing should be able to breathe. I'm not looking at anything that is nylon because you're going to have a lab coat on. And if you're talking about working during the COVID period, you're really going to be so heavily dressed and then it becomes uncomfortable. Protective clothing outside the lab, you still want to be properly dressed out of the actual technical area, but be protective just in case there is a sample in transit. You don't want a sample in transit to spill on you. Wearing of gloves, footwear, respiratory protection is very important. Talking about respiratory protection and talking about SARS-CoV-2 and COVID-19, there has been the conversation around the N95 mask, and there are so many people wearing it. But one of the more important things is not just wearing the mask, but it's also ensuring the fact that the mask actually fits properly. Because you could actually be falsely protecting yourself, thinking that because you have a nice N95 mask, you're being protected. But you have to ensure that you've actually done the fit test, which ensures the fact that there are no particles that actually come through to your nostrils, or else you might still have the mask on. And if you haven't gone through a good fit test, you will still get infected. Then, of course, there are issues of transport of samples and hazardous material. This is really key. Now, a lot of the countries around the world are still now just beginning to decentralize their testing for COVID-19. So we're still in a situation where we still have thousands of samples going through central locations, either to be sorted, to be received, and then redistributed to different laboratories for testing. So we have an issue here with transport, and we just need to make sure that we prevent contamination of workers, we prevent contaminations of patients, and we just ensure that from a public health perspective, that the environment still stays safe. In an earlier presentation I did, I noted that 10% of the infection from COVID-19 is environmental, which means because it's a spore agent, the spores will be out there floating around, and you don't actually need to be in contact with somebody to actually get infected. So again, talking about transport, we need to think about the integrity of the sample, the safety of the carrier, and then the general public and the receiving laboratory. All of this comes into play. Integrity of the sample, the carrier who is going to move the sample from one point to the next, the general public through which the sample is going to go through, and the people at the receiving end. So this means that the samples have to be properly packaged and identified for them to be able to move. Then, of course, there is the big element of waste disposal. As we look into COVID-19, waste disposal is a big thing, because waste disposal, one of the key things with waste disposal now is the fact that we also have reagents, whether they're soluble reagents or they are actually hard reagent packs that need to be destroyed. Some of them actually contain sulfur, and as a result of the fact that they contain sulfur, we need to be very careful in terms of how they are actually destroyed and released into the atmosphere. So there are issues here with waste management objectives, ensuring that we have a policy, we have a procedure that talks about how we're going to handle, collect, and how we're going to be able to handle, collect, and treat transporting samples, disposing of the waste. And then there is also the issue of hazardous waste. All samples and cultures, we need to look at the biological material that they carry on. As I mentioned earlier, there are some of them actually are made from a sulfate base. So we just need to be able to take care of that. Then, of course, there is the non-hazardous waste. Non-hazardous waste is everything that is not actually clinical. And in this case, we're thinking about the paper, insets that come with the reagents, how are we going to dispose of them? But this has to be done pretty frequently just to be able to ensure the fact that we don't keep unnecessary waste around the lab. This is one of my pet peeves, is housekeeping practices. Housekeeping practices has kind of sort of been relegated. We feel comfortable with the fact that we have people who are going to come in and they're going to clean the floors, and they're going to collect the waste, and they're going to go out. It just turns out that these people also need to be trained on the whole waste management idea. They need to be trained to understand what they can do, what they should do, how they should do it, and when they should do it. I just remember it wasn't too long ago, I was actually in a facility where there were people who, the housekeeping people came in to clean. It turns out that they did not know what actually was in their cleaning detergent. While they were cleaning, I noted an irritation in my eyes, and I questioned what kind of detergent they were using to do the cleaning. None of them knew. And I actually challenged the manager at this one lab, and I said to the manager, I said, I could almost guarantee you that because this reagent in the cleaning material is actually affecting my eyes, it might actually be having a negative effect on your rapid detection cartridges. Very interestingly, we decided to look into it. And what did we find out? They had a lot of cartridges which they had to throw away because the cartridges were giving them non-detected results. it actually turned out that when they opened the lab in the morning, they would have an estimate of how many cartridges they would use for malaria, how many cartridges they would use for HIV, and they would leave them on the desk, on their benches, on their workbench. When they leave the cartridges on their workbench, the cleaners come in and they do the cleaning, and the aerosol from their cleaning material actually denatures the strands on the cartridges. So they would actually end up with cartridges that would give them false results. But they did not make the correlation between the fact that it was actually because of the housekeeping practices and their practices with leaving the cartridges on the desk, and whatever it was that was irritating my eyes was actually denaturing the cartridges from being able to be useful. So the whole housekeeping practice is important. We need to make sure that the personnel are trained. They need to understand what's going on in the laboratory. Then incidents, injury, accidents, and occupational illness. I don't know, this is a really important one. Most people get a job and they go straight to work, but you need to be able to be sure that you are occupationally fit to do the job. So you need to be able to go through an occupational test to ensure the fact that you can actually do the job. It says the laboratory shall have a program for reporting laboratory incidents, injuries, accidents, near misses, and occupational illness. This is a very important list. It says laboratory incidents, injuries, accidents, near misses is the one I want you to underline and remember, and then occupational illness, as well as potential hazards with responsibilities of the laboratory staff and safety officer and the laboratory management clearly specified. This only ensures the fact that all the healthcare workers in the laboratory are taken care of. Injuries due to needles and other sharps have been associated with transmission of hepatitis B, hepatitis C, and HIV. This is very commonly known in today's world. So that actually brings me to the end of ISO 15190. I would pause at this point before I go into my national safety precautions. If anybody has a comment with regards to something in the safety area in relation to ISO 15190, which is the medical laboratory standards for quality and competence in a medical laboratory, I would be glad to take any questions or comments at this time. Yes, I know this was a rather shorter piece compared to the first piece. I see Felix, please go on and scream in. Please unmute yourself and then speak. Felix, you are still mute. If you could please unmute yourself and speak. Okay.
Hello?
Yes, Felix, I can hear you.
Hello?
Yes, Felix, I can hear you.
Hello, are you getting me?
Yes, I can hear you, Felix. Please go on.
Yes, thank you so much, Professor, for your wonderful presentation. I just have very few things to put across to what you have really talked about, majorly on safety, about the right concentrations of people using in doing decontamination and disinfection, more especially to our cleaner.
Yes,
from
that's a good one.
Government Hospital. I'm the safety officer. So I had the privilege of going to the various facilities some 2 weeks ago, whereby I found most of the cleaners in the lower facilities. They don't know the right concentration of the jig they are using to clean the floor of the lab or even the facility. Even the same thing applies to our midwives, the nurses, who always uses the high concentration.
I'm sorry, looks like Felix lost his connection completely, but thank you, Felix. You raised a really important point. And as I said earlier on, I wasn't going into any real detail as to what this is. But yes, the issue here is having the right concentration of mixtures before we can go on to use any disinfectants to work. There is another question from Eric. Eric, you have your hands up. Oh, Felix is back. Let me listen to Felix. Eric, please just hold. Felix, please unmute. Eric, if you don't mind, just give Felix a chance to finish. Yes, Felix, go on.
Yeah, sorry, my network went off.
I can hear you now.
Okay, please. Sorry, my network went off. So on my going to the various facilities, on trying to orient people on IPC activities, just for us to make sure COVID should not really be spreading on high numbers, we realize most of the people, they don't know the right concentrations of preparing even 0.5% jig and even for 0.05% for hand washing. So it is really a high time for us with the lab personnel, some of us who really have the knowledge, and I would even request the safety officers who have this knowledge, please, to orient each and every facilities, wherever you are, so that they know the right concentration, because this one helps us in the elimination of the virus when it comes to the spread of COVID-19. Because when you don't prepare the right concentration, definitely the jig that you are really making to do the cleaning, you are not killing the virus actually at that particular time. So I would request most of us who are really having this kind of knowledge, let's try to orient all our staff, all the rest of the staff, so that we know they are really doing the right thing when it comes to cleaning. Secondly, about waste management, most of the facility staff, they really have a very bad attitude when it comes to waste management, more especially in the segregation of the waste. You find that waste that are supposed to be in the red bin, they are in the black bin, or which one we don't really try to segregate all this properly. You are infecting yourself, you are infecting the community, you are even infecting the environment. You're also trying to put the life of the cleaner at a very high risk, not knowing that very same person who had a problem the infection can even recycle and even get back to you. So it is all our role and responsibility to make sure we really make
I'm sorry we lost you again, Felix, but I think I'm going to take it one step further. I think we need to go more than just an orientation, because there is a very big difference between an orientation and a training. And the ISO 5190 talks about a training program. I think it's very important that we actually take our housekeeping staff through a proper training program so that they can appreciate their concentrations, they can appreciate what they need to do, when they need to do it, and how they need to do it. I think that's very important. Thank you so very much indeed, Felix. Thank you so much for having you. That was a really great addition. I had Eric. Is Eric on? Yes, Eric, please just unmute and speak.
Yes, Professor.
I can hear you. Can you hear me? Go on. Yes, I can hear you loud and clear.
Yes, I'm Eric Takaranga. I'm a postgraduate student at Wuhan University in China.
Thank you so much. From China. Thank you.
Oh, yeah. Thank you so much for the wonderful presentation, as usual. My question is about self-collection of samples. So I've been seeing in the United States and even here in China some labs are offering self-collection of sample by the patients themselves. So the kits are given to the patients and they collect samples and then they submit to the lab for the testing. So I wanted to find out what does the ISO on safety talks about self-collection of samples? Does it apply at all or not?
So yes, there is an area on collection, but again, if you go back to ISO 15189, I think that is clause 5.4 of ISO 5189. In clause 5.4 in 5189, it actually talks about collection. And what does it say about collection, specifically to when the client is actually the collector? Because we are so used to thinking that the collection must always be done by the laboratory. No, for example, if the client was going to give you stool or urine, in this case, they're actually the collector. This is what is important, and this is what ISO 15189 addresses. There has to be language that actually explains very clearly to the client how the collection is going to be done. So in spite of the fact that you might be able to explain to the client how to collect, you have to be able to issue them with a brochure. Because remember, when we're in the lab space, the ISO 5189 says that all your points of collection should be familiar with your procedure and standard. And basically what a lot of the labs have done is they've issued their, for lack of a better term, their clinical guide to all the points of collection. You have to be able to have extractions from your clinical guide that are able to tell the client how to collect even urine. They have to understand, is it a midstream or is it whole urine? When is the collection? And you have to have something that you can actually issue to them. Now, in the case of China and the United States, this is a different complexity of clients. And this is a client that you could actually explain the requirements to. You could actually issue them with instructions on how to do the collection. And the hope is that they are going to actually execute it properly because they can understand the instructions. You have explained it to them. You've told them how they're supposed to feel and how they're supposed to transport the sample. So there is nothing in ISO 15189 that prohibits the client from doing the collection. In terms of ISO 15190, it only recommends and requires that once the sample has been collected, the integrity of the sample should be maintained. So the client in this case should ensure that if they're using a nasopharyngeal swab, that once the swab comes out of their nostrils, it should immediately go into the transport media. It should be properly sealed. It should be put into a plastic bag, put into another bag so that we can ensure proper packaging and then transport to, of course, for the safeguard of the public and for the safeguard of the people around the client. The element here is ensuring the safety of the client, ensuring the safety of the public, and ensuring the safety of the people at the laboratory when they receive the sample. You might be familiar with this. There are people who have turned in urine samples and they didn't lock it properly. And so just upon touching the container, there is a huge splash. That is a potential accident that could actually, it's an accident and it's an incident that could potentially happen in the lab space if you're dealing with a COVID-19 collection. So the important element here is ensuring that the client comprehends the insert, comprehends the information that you've given to them, but you must also explain that. And that is addressed in ISO 15189 clause 5.4, and it's also addressed in ISO 15190 when it talks about safety of the client and the healthcare worker.
Okay.
Yeah. Thank you. Okay. Somebody has written in something here. Mwamba Godfrey, thank you, Prof. Killian, for the invitation. Can the vaccine against influenza be used against coronavirus? I think last week we had to deal with this question because last week in our presentation, this was a presentation done from the Uganda Virus Research Institute. They did an explanation where they said that at the very beginning, at the onset of COVID-19 in Uganda, they actually had some cases, some flu cases that were purported to be COVID-19. They went out, they collected the samples, they tested them, they were negative, and then when they actually had a proper reagents to do a COVID-19 or a SARS-CoV-2 test, they found out that the samples were still negative. So I'm not going to say that there was anything that led us to thinking that an influenza vaccine is going to, yes, they belong to the same family, but the infection is actually found on different protein bases and different strands. So there is going to have to be an actual study, and I'm not going to buy into any study that comes from out of Africa. Africa has to do its own study. We can actually clearly see right now when you see the caseload in Africa versus the caseload in China when we had the outbreak, the whole of Asia, Europe or the Americas as a whole, and you compare them to the caseload in Africa, right there is a big telltale sign that we're going to have to do our own vaccine studies to be able to come up with vaccines for the African continent. So I'm very sure for this point that you will not be able to use an influenza vaccine on the SARS-CoV-2. There is nothing that allows us to think that we can do that at this time. Thank you, by the way, for the question and the suggestion. Okay. All right. We're just closing up on the top of the hour. Again, we'll be very glad if you want to share any comments or questions with us. We have at least a few more minutes where we could take that. But again, for all the people who are out there in laboratories, medical laboratories, diagnostic laboratories, public health laboratories, research laboratories, safety in the lab is a very important thing. The standard for that is the ISO 15190, supporting the ISO 15189 for what is going on in laboratory medicine. Going forward, again, COVID-19 is still very much around. So please check your own body, know how your body should respond. And if your body isn't responding the way you expect it to respond, please check your temperatures. That's the first telltale sign. That's why we have the infrared guns all over the place at shopping malls, everywhere you go. I hope all the offices that have resumed for work all have an infrared gun that they can take temperatures. Wash your hands with soap and running water for at least 20 seconds. If you do it for 40 seconds, the happier I would be, but at the very minimum 20 seconds. In the absence of water, please sanitize your hands as often as possible. There is no limit to sanitizing your hands. Please do that as often as possible. Even sanitize your phones. If you put your phone on a top any place and you're not sure what has gone there, please just sanitize the phone. Sanitize everything that comes into your hands because your hands will end up in your eyes, nose, or mouth. And those are the primary conduits for the infection. At all times, please have a face mask on, have some kind of face wear on that protects your nostrils and your mouth. I am lucky that I already wear glasses, so I only have to do the addition of my nostrils and my mouth to protect myself. But I encourage you to please have some kind of face wear on at all times when you are in any group of people. As long as you're with another person, please have one on. And again, this is no excuse. Please continue to have a physical separation between yourself and anybody, at least 2 meters wide. Then you can be sure that the droplets will not be dropping on you and therefore ending up in your eyes, nose, or mouth. Again, you could reach us, email, phone calls, Facebook, or any of our social media handles, or you could just drive by if you're in Uganda and in the Kampala area. You could just drive by and have a conversation with us. We'll be very glad to talk with you about any of the things that have to do with managing systems and how we can develop a strong management system for you. Thank you so very much indeed. And we'll see you same time, same place next week. We look forward to a very exciting discussion next week. We've already had a chance to talk to 2 of the big testing facilities in Uganda. We're going to be talking to another one next week to see what the challenges are going forward. So I welcome you next week, same time, same place. Thank you so very much indeed, and have a wonderful rest of the day and a great rest of the week.